When I meet with a patient in consultation, I'm trying to discuss with the patient how we can make the patient more beautiful, more attractive, and maximize the global facial beauty of that particular individual. So in doing that, sometimes we are just using our tools to change small things that make a subliminal difference, that make the patient look more engaged. For example, if the patient has droopy eyelids, if we lift the lids surgically, we're going to make that patient look more vibrant and engaged and less sleepy and not paying attention. So these small differences, whether they're surgical or using fillers or Botox or lights, lasers to improve the skin quality, are going to make that patient look the best form of themselves and really try to improve their global beauty. Well, how do we do that? We can use all of the different tools like lights, lasers, skincare, Botox, Dysport, fillers, biostimulators, and surgery in an individualized proportion of each of those tools to give the patient their most improvement in the attractiveness of their face. There's a mathematical way that we can help us to, it doesn't dictate it, but it can help us to figure out what is the most ideal form of beauty. And if we look at beauty across all different nationalities and parts of the world, even though two people from different parts of the world may look totally different, when we really start to analyze them, they have the same proportions. And that proportion is called phi. So that proportion is a ratio of parts that we see in 1 to 1.6 mathematical ratio. And we can use that to help mark the face and decide where we want to add volume or take away volume or lengthen or shorten. And so that just helps us in our planning. It doesn't dictate it. I'm going to show you an example of this mathematical ratio using the Buddha today. The intercanthal distance, or the space between the two corners of the eye, does not change over the course of our life. It doesn't sag or change. So we're going to use that as our 1. If we flip this caliper over, this is a ratio of 1 to 1.6. And we can, if we look at the face, our ideal peak of our eyebrow shape in all beautiful people in all different nationalities the peak is going to be at that intercanthal distance, which we're going to say is 1. The length, so that's 1 on this side. That's where we want to see the peak. The length of the eyebrow overall should be the 1.6. The height of the forehead should be 1.6 if we had the hair drawn back. The length of the nose from the radix or the beginning of the nose to the tip should be 1.6. So you can see so far that our model has really nice ideal form of beauty. The chin should be 1, and the length of the chin should be about the same. The peak of the cheek is really important. That's called the OG curve, and that's where we would like to see the most projection of the cheek. So we don't want the most projection of the cheek to be here or way out here. We want it to be from the canthus to the cheek at about this distance. So this is about where we would like to see the peak of the cheek. We may have deflationary changes of fat compartment in other areas of the face, but in the end, that's where we want to see it peak. So we may be restoring some of the fat compartments to make the face more attractive, or to restore lost fat and bone compartments due to aging.